By the time interventional cardiology fellows reach the end of their training, they have absorbed a lot of knowledge and wisdom. So all of you about to dive into a 1 or 2 year program, pay attention. Fellows Forum is here at CRF's 2015 Fellows Conference in Miami, Florida, asking those about to enter the real world, what is your biggest piece of advice for an incoming interventional cardiology fellow?
Personally, I'd like to say that you should try to enjoy the process. It's challenging, but at the same time enjoyable, especially after you're done with the heavy case. Try to be nice to everybody, staff, anybody you're involved with, and definitely be proactive in terms of trying to learn what you can and get the most out of everything that you do.
The best advice that I can give to the incoming people is make use of all the courses that are available out there, especially with CRF and Sky and any industry-sponsored courses, because not all of your programs out there have this kind of distinguished faculty, and you need to basically get experience in a lot more than you actually would get at a single program.
And the biggest advice I have is follow up on your patients, go up and see them, because that's what you're going to be doing in the real world, whether they have a complication or a good outcome. I think it's important to just make sure that you know that you've taken care of the problem and that you've safely discharged them.
When you completed your training or when you've done your residency, it's a great opportunity to have fellowship, and try to do a fellowship in a different institution, and maybe if you need to move to a different country, do it. I think you need to work in different atmosphere and different cath labs so that you see how to deal with different patients, faculty, and meet people like you.
I'd say learn from every complication, whether it's yours or someone else's. And also take advantage of these conferences. There's plenty of them. They're great learning opportunities. They really round you out. And they're also a fun way to meet people and make friends.
I personally, from this year of experience, would like to recommend the incoming fellows to pay a lot of attention to what your attendings teach you, because it's not all about the tricks of the catheter manipulations and the wiring and the devices and stuff. It's also the subtle things like how they talk to the patients and what are the subtle criteria which they look into to basically anticipate problems and then plan accordingly to take care of them.
The most important thing is to know what kind of a practice setting that you're probably looking at to get into the future, and kind of skills that you want to acquire in either the 1 year training or the 2 year fellowship programs that you pick, depending on where you want to do and what you want to do. The other thing is attending meetings like this and courses like this, particularly this is the CRF. The sessions are so intense in many ways, with putting together all the concise trial data out there into one place, getting it all together and tying it, and I think that's more important, and trying to do that. It's hard, I guess, when we're in fellowship to take the time out to do this, but I think it's very, very important to actually make that time and use your personal vacation if need be.
Mine would be to show up on time, have a positive attitude, include all members of your team, including your nurses and your staff, but most of all, have fun. This is the best year of your training, and you're going to love it.